How legislation gets passed in Washington state. Brought to you by Whole Washington for universal healthcare. First, what does the legislature look like? In the Senate, there are 49 members, one for each legislative district. The current breakdown is 30 Democrats and 19 Republicans. In the House, there are 98 members, two for each district. The current breakdown is 59 Democrats and 39 Republicans. The redistricting committee made this map, and here it is without colors. The two-year legislative session. Legislative sessions begin in the second Monday in January. If it's an odd year, the legislative session has 105 days. The session is longer because legislators must come up with a two-year budget. In even years, the legislative session is 60 days. For example, in 2025, the legislative session began January 13th and ended April 27th, 105 days later. The 2025 and 2026 sessions share the same bills and bill numbers. So every odd year is the beginning of a two-year legislative session, and every even year has the end of that session. The Washington Health Trust is the bill we're going to be looking at in terms of its passage through the legislature. The Washington Health Trust is single-payer healthcare in Washington state. There will be no bills, deductibles, copays, medical debt, or networks. Medical, dental, vision, hearing, mental health, and reproductive care are covered, and all Washington state residents would be eligible. The process for our legislation. Step 1. Get introduced in the chambers. The Washington Health Trust was introduced in both chambers for the first time in 2025, and for this, you need a prime sponsor to bring the bill forward and get a first reading. Step 2. Get passed in committee. For the Washington Health Trust in the Senate, this is the Health and Long-Term Care Committee. In the House, this is the Healthcare and Wellness Committee. There are three ways for a bill to pass committee. Do pass, which is passing as is. Do pass as amended, which is passing the bill amended by the committee members. And do pass as substitute, when the committee offers a substitute version of the bill. Bills must pass committee by mid-February in odd years or late January in even years. Now, for the Washington Health Trust, the mandatory other committee would be the Fiscal Committee because it will change the tax code to provide funding for the Washington Health Trust. In the Senate, this would be the Senate Ways and Means Committee. In the House, this would be the House Committee on Appropriations. Any bill that affects the tax code must go through these committees, and they have the same options: do pass as amended, and do pass as substitute. Step 3 is the Rules Committee. Rules decides what bills get voted in on the floor. It's a tool of the leadership to exercise control. The options for the Rules Committee are X-file, which means they kill the bill; place on the calendar, which means it gets scheduled for a vote; second reading, which lets the chamber discuss the bill and offer amendments; the third reading, this is the vote. After the third reading, a floor vote is taken for the bill. If it passes, it moves on to the next step. If it fails, the chamber has 24 hours to make a motion to reconsider the bill. A passed bill then moves to the other chamber. Step 5, the other chamber or reconciliation. The same process occurs to the second chamber as the first. Any differences between the bills need to be reconciled, and there are two ways this can happen. Concurring in amendments. If the second chamber amends the bill, it goes back to the first chamber to be approved. This can go back and forth. The other alternative is a conference committee. This is a committee consisting of members of both chambers that iron out a bill that can be passed. Step 6, the governor's signature. A legislature is considered passed when it has passed both chambers and has been signed by the Speaker of the House and the President of the Senate. The governor then chooses to approve the bill in entirety and sign it into law, veto a section of the bill but still sign it into law, or veto the entire bill. And step 7 is get implemented. Our advocacy is not over after a bill gets signed into law. Vermont's universal healthcare actually made it this far and was stopped by the governor, mostly due to a lack of funding, which our bill would not have a problem with. The transition team will make sure that all problems are addressed and Washingtonians can start accessing comprehensive universal healthcare. To visualize this process, step 1, get introduced in the House or the Senate. Step 2, pass the Healthcare and Wellness Committee in the House or the Health and Long-Term Care Committee in the Senate. Step 2.5, pass Ways and Means or Appropriation, the 2 fiscal committees. Step 3, pass the Rules Committee in each chamber. Step 4, get their readings. Step 5, the other chamber and reconciliation, which can go back and forth and ping pong between the 2 chambers. Step 6, the governor's signature. And step 7, implementation. Want to help universal healthcare succeed in Washington? Check us out at wholewashington.org.